have here is a goniometer. Keep in mind that the goniometer actually is composed of three different parts. We have an immovable or a stationary arm that's actually connected to the protractor, and then we have the movable arm that follows the motion of the patient. In the middle of the goniometer, where the screw is located, is what we call the fulcrum. The fulcrum is also lined up with the axis. So with that being said, let us begin with our goniometric measuring. We're going to be measuring wrist flexion and extension, but if you'll notice, her shoulder is in 90 degrees of flexion, abduction, and her elbow is in 90 degrees of flexion. We're going to actually start her in a neutral position, but just to demonstrate, the movement for flexion is for the patient to actually bend their wrist, and we're going to ask her, we're going to move her forward just a little bit to make sure we clear the table. So that's wrist flexion. Okay, I bring her back to neutral, and I find her triquetrum just distal to her ulnar styloid to locate her fulcrum or her axis. And then I'm going to actually make my usual movable arm my stationary arm so that you can actually see the numbers here. So the fulcrum is at the triquetrum. This will be our proximal arm, our stationary arm. The movable arm will actually line up parallel to the fifth metacarpal. And then I ask the patient, Charday, if you will bend your wrist for me, keeping everything else stabilized. Follow her down as far as she can go. For flexion, our normative data is 60 to 80 degrees. And as you can see, she's at 85 degrees of flexion. All right, we'll bring it back up. Okay, we're here with Charday, and we're going to now measure her wrist extension. So I'm going to ask her to bring her wrist back almost as though she's making a motion to say stop. Okay, and I'm going to bring her back to neutral. We're going to find the same fulcrum, which is just distal to the ulnar styloid, which is the triquetrum. And let me change it this way. And I'm going to have the movable arm along the ulnar aspect and the stationary arm along the ulnar aspect using the Electronon process as a point of reference. And the movable arm is going to be lined up with the fifth metacarpal. And then I ask her to actually bend her wrist up. Okay, make sure that we reposition. And she is coming in at 65 degrees of wrist extension, and the norm for that is between 60 and 75. Okay.